The device that we're currently using now to train all of our combat medics and soldiers on managing battlefield trauma management.
Okay.
So what we have here is a patient that has sustained severe trauma from a blast injury and also has sustained gunshot wounds.
Okay.
So what we do is we try to teach the soldiers and the medics how to manage the 3 survivable injuries that occur on a battlefield. Those 3 survivable injuries are exsanguination or massive bleeding, a sucking chest wound from a gunshot wound to the chest, and then also airway management problems.
Okay.
So the United States Army does studies every time we go into battle, and we found that usually we start at about a 90% survival rate. Okay. So most of the guys that are injured, 90% of them survive with no problem. That 10% though, we constantly have to relearn how to manage that last 10% and bring that number down. And that 10% those are guys that should not have died, that did die because they had survivable wounds.
Okay.
So this is designed to train the soldiers and the medics how to manage those specific types of
very specific focus
exactly
on,
on those types of injuries.
Okay.
So it's those 3 anyone can manage. So we teach what most people were accustomed to was ABCs, airway, breathing, circulation, in that order.
Yep.
We flipped it. We've gone with circulation first because on the battlefield, 1A medics don't carry blood, and it'll be sometimes 30 to 45 minutes before you can get someplace where blood can be put on.
Sure.
Airway is not as much of a concern, mainly because usually when an injury occurs on the battlefield, you were just talking to this guy right before it occurred.
Yeah.
So he had a functioning airway. So you're not worried about his airway for 4 to 6 minutes before brain damage occurs. So this, you can't afford to lose anything. You've got 4 to 6 minutes to manage the airway. So that's the reason why we flipped it, focusing more on keeping blood inside the guy, survival.
Right.
So then the airway comes next. So after we take care of the bleeding, we manage to make sure he's got an airway and he's breathing. Of course, if he's sitting there screaming and yelling, he's got an airway, good to go.
Yeah.
So then you're just managing now the other injuries.
Okay.
So one of the things that we had a problem with was soldiers training on soldiers. They never actually do the procedure that they're supposed to do. They simulate.
Yeah.
So you never put a tourniquet on as hard as you'd have to put a tourniquet on.
Of course not. So
You would never sink a 3-inch needle in your buddy's chest. Okay? So, and then there's other injuries which have to be simulated, which you can't simulate.
of course.
So, this one is an inguinal wound and it involves arterial bleeding.
Yep.
So, you can't simulate these kind of wounds. So, what we asked our manufacturer to do was create something that would allow us to train those 3 particular injuries. And then we've added additional injuries as we've learned things that come out of the battlefield. So here you have something that looks like a very bad wound.
Yeah.
This looks ugly, but this is actually a minor wound that you don't have to worry about.
In terms of life.
Yes. When you're looking at life-threatening, this is an oozing wound, not really that bad. The only thing that's a complication is it's a bilateral fracture. Both bones are cracked. So you've got an impaled object here, you have an inguinal bleed here, you've got lacerations in different places, you've got the gunshot wound to the chest, there's also a gunshot wound on the opposite side, on the back side of this chest. So what you can do is you can create a situation where it's obvious this is a wound here, but this is actually the damaged lung.
Sure.
So you can create different scenarios and change it so that the individual has to actually do a correct survey of the entire body and find all of the wounds. In addition to that, this particular device, it breathes, so you can create to where it has bilateral rise and fall of the chest. It has pulses, so you can check for pulses. This one allows for IVs to be put on. It also allows for what's called an interosseous infusion, which is an actual drilling through the bone into the marrow to infuse fluids. So this allows for that here and also here. Okay, because those are your 2 spots that you would do that particular procedure. It also allows for what's called a cricothyrotomy, which is an artificial airway that you can create by cutting into the throat. Most people are familiar with a tracheostomy, but that's more of a surgical procedure, a little bit more advanced. This is cric. It can be taught to a person in about 3 or 4 days, and you can do it in about 60 seconds. I've done it as fast as 35 seconds on a patient. And then, of course, as you get into the airway is very realistic. You can do this intubation. The jaw is fully mobile. Allows you to do all types of maneuvers. Okay? It has a head injury. If you want to simulate that the head injury is an internal bleed in the skull, you can change the pupils.
Okay.
So now this would be an contraindication to inserting a nasopharyngeal airway. The nasopharyngeal airway works. It goes all the way back into the nasopharynx, and you can actually see it come down in the back of the oropharynx. So, and with this device, you can also create it to where you can't put that in. There are devices inside here that will block that.
So the instructor
it
can
forces you to actually go through. So what it does is it takes the instructor out of the scenario and forces the student to actually analyze what's going on with the patient.
Okay. Fantastic. Obviously, lots of squirming going on. That's
Yes.
part of the
Yes,
the
it's part of,
authentic experience.
part of the thing, it's part of the realism.
Sure.
Try to get some movement out of it. It's something they don't expect.
Yep.
They're accustomed to seeing mannequins that don't move, so this one has some motion to it, which throws them off. It also, if you use it in a mass casualty situation, now you're looking out across the field and you're seeing patients moving.
Ah, okay.
They're not just there's not a bunch of bodies laying out on the ground. They're actually moving. So you have some animation out of this as well. These particular devices were made in California by Trauma Effects. The company, I like to tell the story because it's kind of cool. If you're familiar with Star Wars, the original Industrial Light and Magic, George Lucas's Industrial Light and Magic, those guys that worked in Industrial Light and Magic now work for this company and create these devices. That's the reason why you're looking at such realism.
Yeah.
Because that's their craft.
Right, that is a cool story.
Does it bleed? I mean,
Oh,
as a
it bleeds. Get ready to hit it.
oh.
So, go ahead and hit start. Okay, so I'm holding up the leg so you can get it and look at it. I'm going to release the tourniquet because I actually have it on so it won't bleed. But as you can see, as I release the tourniquet, should we zoom?
Yeah.
You in there?
Right there.
Right.
So it's bleeding. And of course, I have to now apply the tourniquet, and if I don't apply it adequately, it will continue to bleed until I do.
So as you say, you actually need to apply it to a proper degree of tightness, which you would never normally do.
Right. So like I've just tightened it up. It's still bleeding a little bit. Is it say controlled? Okay, so it actually will let the instructor, he doesn't have to say, look at it and say, did he actually stop it? No, he actually will tell him it stopped.